Hello, everyone. Thank you for joining the Growth Lab's COVID-19 Response and Recovery event as part of Harvard's Worldwide Week. I'm Chuck McKenney, the Growth Lab's Associate Director of Communications and Outreach. The Growth Lab is a research program housed at Harvard Kennedy School. We work to understand the dynamics of growth and to translate those insights into more effective policymaking in developing countries. This event will feature a discussion with Growth Lab Faculty Director Ricardo Hausman and COVID-19 task force members about the research we conducted around the pandemic and its potential impacts. We will also highlight how the Growth Lab has integrated this research into country-specific projects, focusing on our work in developing government response and economic recovery plans. Before we dive in, I have a few announcements related to this event. The event is currently being streamed to YouTube and being recorded for future use. We'll be taking questions from the audience at the end of the presentation. You can submit your questions beforehand using the Q&A function or raise your hand during the Q&A portion of the event. And to learn more about today's speakers, please click the links provided in the chat. It's my pleasure to introduce Ricardo Hausman, the founder and director of Harvard's Growth Lab, and Rafiq Hariri, professor of the practice of international political economy at Harvard Kennedy School. Ricardo?
You're muted, Ricardo.
Yeah. Well, they say that you're still mute is the most frequent words and sentence said in Zoom. So welcome. It's really an honor and a pleasure to be here with you to discuss and to share with you the experience we have had working with about a dozen countries on how to deal with pandemic that they were facing starting in March. I'm going to, let me see, do I have share screen? Can you allow me to share screen? Yes, there we go. When we started, this was essentially, a problem that that was affecting rich countries in terms of the disease, but everybody very quickly imposed lockdowns. If we look at, for example, the picture as of May 15th, what you have on the x-axis is how rich were countries, and on the y-axis, what was the cumulative deaths per million inhabitants. The most affected countries were Belgium, Spain, Italy, Great Britain, France, Sweden, Netherlands, Ireland, the US, Switzerland. And only there would you get, Ecuador, and then Portugal, Denmark, etc. It was a rich country phenomenon. If you take the picture as of September 29, then it becomes a very different story. Now Peru is the one that has had most cumulative deaths, followed by Belgium, but then you immediately have Chile, Brazil, Ecuador, Bolivia, and so on and so forth. So it has become right now a middle income problem in terms of disease. If you look at how countries responded, everybody imposed lockdowns very early on, and not everybody, as we will see shortly. But say I'm comparing Colombia with the US. This is the fall in mobility to work, and this is the fall in mobility to work in the US. So the lockdown in Colombia was more severe than in the US, but the US had this peak in deaths that Colombia didn't have. Colombia has remained more locked down than the US, but now Colombia has a peak that is much bigger than the peak in the US. So, here you declare victory. Here, you were wondering, what happened with your lockdown that did not prevent this much higher peak of deaths now in Colombia than in the US. Now, if we look at the integral of the lockdown, how much, people have locked down, you'll find out that, interestingly, Panama, Peru, Philippines, Bolivia, Ecuador, Chile, Colombia are the ones that have seen the biggest lockdowns. On the x-axis is how much did you stay at home. On the y-axis is how much did you stop going to work. Obviously, these things are related, but it's not just that people didn't go to work. It's also that they stayed at home de facto, according to Google. And that means that these lockdowns have been very very costly. And this is very, very, very tough in developing countries. And this is how costly they have been in terms of output. As you see, the decline in output in the second quarter in both charts it's really, you know, orders of magnitude larger than anything that these countries have seen in the past. Let me stop sharing here my screen for a second. Oh, if I could only find my cursor. Okay, so and let me just say that, you know, when we started to think about this problem, obviously we had to think of, you know, what does it mean for people to stay at home? So, you know, what kind of a shock is that? Obviously, it means, you know, there's less labor in the economy producing stuff. How does that impact the economy? How would it affect the economy? But also immediately we saw that countries were being impacted by a collapse in exports, by a complete stop in tourism, and by a hit in remittances. And in addition, we saw that capital markets were being impacted in terms of, you know, capital markets not being that enthusiastic to finance these countries. And that is something that got us really, really scared in March and April. It turned around quite nicely in June. And since then, you know, as for things that we will discuss later, countries have been accessing those markets in part. We have been advising that they do in that period. So all of these shocks also have been translated into fiscal shocks to the government, both spending shocks that they need to fund, you know, epidemiological efforts, health efforts, social transfers, and so on. So spending shocks, but also collapse in tax revenues and consequently an increase in financing needs. So the question for us was, you know, how can we help countries think through all of these issues? Very quickly on, we organized a conference with all the countries that the Growth Lab works with. You know, the Growth Lab is a group of about 50 of us that do both academic research and applied research. And we gathered our network of partners and we started to have conversations. And in some of them, we had actual programs, and others, we just had conversations. So the first thing that we asked ourselves is how to think systematically about this problem. You know, there were lockdowns, there were fiscal transfers. How should we think about it? So I asked Ulrich Schetter, who's a postdoc, a research fellow at the Growth Lab, to help us think through, you know, what are the trade-offs, how are poor countries different, and what should we pay attention to? So Ulrich.
Thank you very much, Ricardo. Let me briefly share my screen as well. So as Ricardo said, we were thinking about, from a conceptual framework, how key trade-offs are looking like in fighting the pandemic, with a specific focus on developing countries. And I just want to give you a very brief overview of main insights from this work and key ideas. So in the absence of a vaccine or a treatment, the most effective policy measures that we're having to fight the pandemic are lockdowns, right? So it's a reduction in social and economic interactions. And while these lockdowns have shown to be quite successful in terms of fighting the pandemic, at least in parts of the world, they are very costly for the economy, giving rise to the much debated trade-off between lives and livelihoods, between saving households from the pandemic and saving the economy. And in the industrialized world, many people agree that the enormous value at stake in terms of the pandemic, of threat to lives from the pandemic, justifies the large economic losses that we're currently facing, right? And there's also like academic research supporting this view. But what this assumes is that households have the ability to absorb the economic shocks. And while this may be true in many industrialized countries, it's not necessarily the case in developing countries where parts of the population are close to subsistence. And what we argue in our paper is that in these countries, a lockdown that distorts the economy and deepens the recession may be very costly, because it may imply that additional households suffer from deprivation, giving rise to an even more excruciating trade-off between lives and lives, between saving households from the pandemic or saving them from deprivation. And if you look, for example, at forecasts from the World Food Programme, which suggest that global hunger may almost double in 2020, then this indicates that this trade-off is a real trade-off and a real concern in parts of the world. And so what we were doing is we were developing a theoretical model which helped us think through some of these trade-offs in a consistent way. And some of the key insights is that optimal lockdowns are less strict in poorer countries where a larger fraction of the population is in poverty. So these countries are more concerned by deprivation vis-a-vis the pandemic. And transfer payments are very important in times of pandemic because they help alleviate this trade-off between lives and lives. And they actually help alleviate this trade-off from both ends. So they directly help freeing households from deprivation by providing them with additional resources, and that helps them to live through the recession. But they also help households to better comply with the lockdown. And hence, a lockdown is going to be more effective if you have more transfer payments, and this is good to fight the pandemic. And of course, the flip side of the same argument is that limited fiscal space is very costly in times of a pandemic, and that is particularly true for developing countries. So if they have limited fiscal space, they are forced to fight less the pandemic. More people die from the pandemic, and still this may not be enough to help to free everyone from deprivation, and they may suffer from a large aggregate death burden and enormous welfare losses in times of the pandemic if they have limited fiscal space. Thank you very much, and I pass it on to Shreyas, who's going to speak more about the epidemiological side.
Yeah, so Shreyas is also a research fellow at the Growth Lab, and he helped us think through, we are not epidemiologists, but the epidemiology is too important for us to understand if we're going to think about the timing and the depth of things. So Shreyas, go ahead.
Thank you, Ricardo. Let me just share my screen here as well. Yes. So what we wanted to do was try to understand what lessons we can get from epidemiology and epidemiological modeling. So I'll just talk about what we did first and then what we learned from that. So we wanted to understand what a pandemic is, how it works, what epidemiological models exist, and what they'd be useful for. And most importantly, what we don't know as well as what we know. And to this end, we worked with and we reached out to Professor Mark Lipsitch and group at the School of Public Health, who are very generous with their time and helped us understand what these models were. And we tried to gather as much information as possible from other epidemiologists as well, including Dr. Alison Hill at Johns Hopkins. And we used various existing models that were out there, as well as built our own custom models to try and simulate all the possible policy scenarios or various relevant policy scenarios and understand how various parameters and phenomena in society would affect these parameters. And try to see what would be most relevant to the governments that we were working with. So we tried to act as a bridge between the epidemiologists and the lessons from epidemiology and several governments. So either directly or indirectly, we worked. We tried to pass along these messages to governments of Albania, Ethiopia, El Salvador, and several others. And to go on to what we learned from all this work, the primary thing we learned was that there was a lot of uncertainty involved. But these models, even though they are not accurate, were very useful as tools that could help contrast policy scenarios. We understood what the parameters such as the reproduction number and how targeting these parameters would be important. And I think one of the most important lessons to me was that there was a lack of nuance in public messaging. So according to the models, we learned that a complete return to normal after a lockdown would not flatten the peak and would just buy us time for the healthcare system. And that the pandemic was something that would go on for an extended period of time, and the economic impacts from the pandemic would also go on for potentially years from now, and that was very far from what the policymakers that we were working with very often started with their assumptions from. And so, we also learned that low-cost interventions were critical, and should be, and we tried to spread that message around as well.
Thank you very much, Shreyas. Thank you very much, Shreyas. Let's move now on to Ibrahim Hassan. Ibrahim is working on our Ethiopia project. He's from Ethiopia. And Ethiopia is one of these countries that Ulrich spoke about that is very, very low income. So the trade-offs between saving lives and saving lives is particularly strong. So Shreyas, sorry, Ibrahim, please go ahead.
Can you please allow me?
Allow you what?
To share screen and start video. Yes, here it comes.
Okay, good. Go ahead.
So our team has been working on JPM project for the past like 2 years. So we looked at COVID. Ethiopia has got its own unique characters. There is a massive social interaction. So we recognize that there is a need for having like a homegrown strategy to tackle this shock. We looked at various factors why a standard lockdown would not be applicable. There are like more than like 8.5 million people living in PSNP. There is a huge chunk of population in both in urban and secondary towns. Again, if we implement this total lockdown, it will disrupt the total value chains. So the social cost of this lockdown by far exceeds just allowing a normal transaction. So lockdown was not practical. So with a partial lockdown, it will allow like the government to build the healthcare system, to reduce the chance of infection, to prepare resource mobilization and the like. So we suggested some strategies like geospatial lockdown, monitoring markets where agencies would interact, like rural urban population would interact, and also like boosting testing capabilities. During our like 2 years engagement, we identified like foreign exchange to be the binding constraint. And when you add COVID to this challenge, it would mean like having a meningitis for a person who is still suffering from like goiter. So the country was still suffering from like data accumulation. There is a limited physical space. So we suggested for like the international community to intervene in different forms. The first one being like debt forgiveness, and the other one is like foreign injections from IMF, World Bank, and other donor agencies. They used to have like a standard mechanism of supporting governments. Because COVID is extraordinary, it calls for like extraordinary arrangements to support the Ethiopian government. That's the key lessons that we provide for the government. Thank you.
Thank you very much. Thank you very much, Ibrahim. And now we're going to move on to Ricardo Villasmil, who's a senior research fellow at the Growth Lab. And we asked Ricardo to develop tools for us to think through, you know, the macroeconomic shocks and the fiscal shocks that economies would go under. So, Ricardo, you have the floor.
Yes, I'm going to share my screen a little bit. So what? As previous panelists have been arguing, this is a complex pandemic. It has the characteristic of it hitting the world as a whole, causing a global demand shock for each particular country in the world, because its demand from the outside is curtailed by the impossibility of flying into the country, of purchasing some goods and services from that country. So that obviously hits all sort of variables inside the economy, not only GDP, but also employment. And it does so in a very asymmetric fashion, as many have discussed. because some occupations are more vulnerable than others. It has an impact on the financial system because of the inability to pay that certain credit customers have engaged in. It has an impact in the balance of payments, of course, because of the fiscal of the export, import, remittances, all the effects on FDI and so forth. Clearly on the fiscal, because the government suffer from a collection problem, and as Ricardo was saying, increased tensions or pressures to spend in vulnerable sectors, and particularly firms and households. So as many have been saying, the key word probably is uncertainty. The uncertainty is huge, not only in terms of the pandemic itself from an epidemiology standpoint, but also in its economic impact, its depth, the impact that it's going to have. At first, it was thought to be simply a 1 to 3 months phenomenon, and then we'd go back to normal. And it's much deeper and more extended through time than it was originally thought. We still today do not know how long it will take to return to normal, if there's a normal that can be defined at this point. This interplay between lives and livelihoods are still something we're grappling to understand because it's more complex and more heterogeneous than we thought. So creating a learning environment in this context is key, both in the epidemiology side and on the economic side. Some countries are clearly, as Ricardo mentioned in the introduction, more vulnerable than others, either because they have less fiscal space because of their access to credit and their structure of the fiscal economy and the characteristic of that economy. Some are highly dependent on tourism. Other are also dependent on oil exports, which oil prices collapsed, halved during this period, or have large informal sectors of the economy that simply cannot lock down because of the Ulrich discussion we just had minutes ago. So, and some have state capacity that can manage the pandemic, control the population, support firms and households, and others simply do not. So we have to tailor to the specificity of each country. So what we tried to do to try to size the economic impact of this is we took the expenditure approach to nominal GDP, which is particularly easy to do because we have data. Every country has data, either yearly or sometimes even quarterly, of the national accounts. And so the usual equation is, GDP is consumption plus income plus government expenditures plus exports minus imports. So we have data from the previous years. We break down exports and imports of goods and services into categories that are useful to forecast what will happen in the as a consequence of the pandemic. So what we try to do is we discuss with the authorities, experts in each sector, and try to find what we find best guesstimates for the impact that each will have for 2020. So like if you're highly dependent on tourism, for instance, you're going to say that your exports of travel and tourism are going to be badly hit. And we try to find an estimate for the whole year of how that will perform, and we'll discuss about this in a minute. And in imports, say the oil price went down, so you're going to have smaller payments of oil for this year. So that's a plus in your account. So what comes as a consequence is an estimate of what's going to happen for that particular year in terms of the fall in GDP, because as income falls, you also have a second round effect of consumption falling and imports falling as a consequence. Of course, this is something you have to be continuously updating as more information is revealed, but the economies and the governments publish this information. We get secondary indicators that help us see how exports are doing, imports, investments, and so forth. But it's important to be conservative, plan for the worst, and distinguish between the temporary and permanent components of the shock. For instance, the oil prices are not suffering what we would call a temporary shock due to COVID, but it's perceived to be a more permanent feature of the economy. So you have to plan fiscally for a lower oil price in the future. So in terms of the fiscal impact that this has caused, I'm sorry, I don't know why this is not, that this has caused, this is the visual representation of what we just saw. What we can see here is that from a fiscal standpoint, what you have is a prediction of what will happen to consumption, imports, and GDP as a whole. And that's more or less the tax base for government revenues, right? So you can assume that VAT, income taxes, and taxes on trade are going to fall as a consequence. Given the composition and the particular tax basis of each country, we can estimate the fall of government revenues for the year as a whole. We can see what are the plans of the government, either to cut spending in some areas, but increase spending in some areas such as health and support for firms and households that are in a vulnerable position. But in any case, what we find is that the fiscal balance is going to deteriorate sharply, creating a sharp increase in the financial needs for the government. So the first recommendation that we issued to the ministers of finance of the different governments we are engaged in is to tap in any availability you have with the IMF and other forms of concessionary finance first, try to maximize their income from that source. And if it's not needed, it's better to have too much than to have too little. To tap financial markets, especially if you find opportunities that are not so costly to do so, and to tap in other sources, non-conventional sources that may be available, either sometimes through the central bank or through national funds that may have access to that may provide finance for the government. So that's kind of like the approach we took for sizing this impact in the different countries we're working on. Thank you, Ricardo.
Thank you, Ricardo. And now we're going to move on to Lucio Castro. Lucio Castro is a research manager at the Growth Lab. He's been managing our engagements in Honduras and in South Africa. Lucio, why don't you share with us some of our learnings?
Yeah, let me just share with you some of our learning from both projects. I think the first one, and that's related to what both Ricardo were saying, is that back in March and April, I think governments tended to underestimate the duration of the pandemic. And this optimistic outlook was reflected in turn in non-realistic growth and fiscal projections for this year, but also for next year. At that time, the buzzword that we got from government was that this was a couple of months affairs at worst. So based on our research and our conversation with epidemiologists, we advised the governments that were working at that time with both Honduras and El Salvador that there would be no return to normal until a vaccine became available. We saw, and Ricardo was describing that at the beginning, that we are basically in the midst of an intermittent economy, where we're going to have returns to lockdown, basically as a response to contagion outburst. And this is going to create supply shocks, and it's going to create as well uncertainty to both consumers and investors. And this is going to be reflected at time also in unstable sub-trend growth rates. And the most important issue, I mean, from the policy perspective, particularly for fiscal projection, is that we envisage at that time, and that was our base of our conversation with governments, is that it's going to be a permanent loss in GDP, and particularly in the next 4 years. So the main implication, and I think Ricardo was emphasizing that in the previous presentation, in terms of the main policy implication for governments, is that they should aim for the best, but prepare for the worst. And that basically entails for countries like Honduras that had very good standing in international capital markets to try to get as much capital as possible at that time in order to respond to the pandemic, and also to negotiate with international financial organizations, if possible, additional resources. The second implication is to try to plan for the possibility of the need for more expenditure in terms of providing income support to both firms and households. And also that's something that many governments were not planning at that time for the vaccination programs when the vaccine became available. And the final implication that we discussed quite extensively with governments is the need to integrate fiscal and sanitary policy. In many countries, what we found in both countries that sometimes the sanitary or the health policy was kind of disintegrated or not integrated with the fiscal policy. And therefore, they need to be integrated because otherwise fiscal policy and macroeconomic policy in general would not become as effective as it needed in the middle of a crisis like this one. And more importantly, there is a need, and Ricardo emphasized that, Ricardo Hausmann, the need of a data-driven approach to both economic policy, but particularly for the policy intended to contain the pandemic. And finally, the final takeaway we got from the experience of both countries is that you might need more resources in this crisis that you originally intended. If the crisis lasted more than everybody envisages, most likely until sometime of next year, until the vaccine becomes available, you need to get as much resources as possible now. You have to plan again for the worst. And this is, as Ricardo always emphasizes, it's better to have more resources than needed in the middle of a crisis than not having resources in the middle of a crisis. And the final takeaway that we got, and maybe that's particular for the case of South Africa, is that, quoting a famous American politician, you never should let a good crisis go to waste. I mean, this is a terrible crisis with massive impacts, particularly on the poorest household, but also it's an opportunity to pass long-needed, long-lasting reforms that can ignite or restart growth in countries that have been stagnant for a long time. But that requires some sort of political consensus, and that requires also political leadership in terms of carry out these long-needed reforms. So I would just summarize that, Ricardo, in terms of the learnings or the main takeaways from our experience, both in South Africa and Honduras.
Thank you very much, Lucio. Now we're going to move to a different region. Semire Kasulu, who's a research manager at the Growth Lab. She co-manages our projects in Jordan and in Ethiopia. In Saudi Arabia. So Semi, why don't you share with us your takeaways?
Sure. I would just say that we're still learning in Jordan, and as we're continuing to be engaged with them to support the government of Jordan in their journey in assessing the COVID impact and using our research findings to help the government respond to COVID and plan a successful recovery. But what comes out of Jordan is a story of initial huge success in controlling the spread of the disease with a very strict lockdown and a continued resilience in the face of continuing uncertainty and the major macro shock. So Jordan started very strong on the epidemiological side, having suppressed the spread of the disease in the first 5 months. And it was an outlier compared to all other countries. They had a very strict lockdown in effect, but also they had a selective way of keeping their major economic activities going on. And that's how we see that they have a robust export base that went down only 2 to 3% in the first 7 months of this year compared to last year. That our work also included supporting the government of Jordan as they tapped into global capital markets in June, and their bond issuance was oversubscribed 6 times and they had favorable terms, so that was a very timely intervention. Having said that, there are still macro uncertainties, as we heard from other countries. We still don't know what the path to recovery of the tourism sector will look like, and that is an important sector in Jordan. And we're still assessing the effect of COVID on remittances, which are also important in Jordan. And Jordan has entered into their first wave of COVID infections now, showing that this challenge keeps evolving, and there won't be a sustainable solution until there's a vaccination program. I would end this with saying that we have an ongoing work with the government of Jordan and the IMF to work towards a plan for sustainable long-term recovery and growth in Jordan. And we're also looking into the evolving opportunities that the country can have a comparative advantage in, and start developing and tapping into them to capitalize on their high-skilled labor force and their ability to attract high-skilled services that can be done remotely.
Thank you very much, Semi. And finally, we're going to move on to Saudi Arabia. Tim Cheston is a research manager at the Growth Lab, and he's a co-manager of both the Saudi Arabia and the Ethiopia project. So, Tim.
Excellent, thank you. And if somebody can let me start my video, it would be good. So thanks. As Ricardo was summarizing, this is quite a unique crisis for many countries. That this is not like the global financial crisis when the crisis hit a financial sector. In fact, this is probably the first crisis that uniquely disproportionately hit a lot of the traded services that now represent large shares of many economies. So as Ibrahim said, we have a very different crisis to face in a country that is like Ethiopia, that is focused heavily on the transport sector. And the governments had to move very adeptly to rethink how the airline industry and Ethiopian Airlines can move from a passenger-heavy focus to a shipment-heavy focus in order to minimize the losses of that sector. So we had a very non-traditional crisis that is the focus of our conversation today. But on top of that, we also had a very traditional oil price shock that came also from the effects of the global demand shock that Dr. Ricardo Villasmil mentioned earlier. So for the countries, the oil country economies that we also work with, we had to differentiate the nature of these crises. That there were short-term shocks to sectors like tourism, transport, and others that were unprecedented and non-traditional. But there was also this long-term shock to the adjustment necessary to move towards the long-term adjustment to oil prices. So when countries had to think about the new fiscal deficits they were undertaking, we spent significant time trying to guide them through what is the difference between what is the necessary additional health expenditures to address the virus, the health expenditures in order to save livelihoods, but also how do you need to really adjust the fiscal break-even oil price to the long term. And in particular, we really emphasize the need to restore market confidence to ensure that the debt plan is sustainable, that any new debt for this shock would still restore confidence that the long-term plan was there. So Ricardo can speak to some of the work that Semi-Ray mentioned in Jordan, as well as Albania. But this crisis came with many different shocks in many different countries. And the oil economies were certainly feeling the brunt of this crisis on many fronts. And yet there has been some strong management within restoring market confidence on the debt plans in many of these economies. So thank you, Ricardo.
Thank you very much, Tim. Let me share my screen to tell you a little bit what are the things that we are thinking about now and that are keeping us awake at night. So the first one is that we think we need to focus on increasing the efficiency of social distancing. We have social distancing measures in countries that have shown to be extremely costly economically and not very effective in terms of reducing contagion. What we've learned through that experience is that every country is very different. There's no such thing as best practices. That, you know, in the US, by the month of June, over 40% of the deaths were in nursing homes. In many of the countries that we work on, there is no such thing as nursing homes. In the US, you could tell people to stay home and send them a check. Well, in many of these countries, people tend to leave home in order to be able to try to either earn a living or just to buy food. So how you organize these things so that you reduce contagion as people carry on their lives is something that countries need to work on, and they need to sort of like gather the right data and know how to analyze the data that they are gathering. So we think that this is a very important activity, because optimistically, we will have vaccinated significant portions of the population, say in a year's time. So that's like twice the amount of time that we have been battling this virus since it was declared a global pandemic. I think countries need to make sure that they get access to a vaccine, and they need to work on a vaccination strategy. We wish there was more international coordination, and that the World Health Organization would be at the forefront of this, but unfortunately, there hasn't been. The U.S. left the World Health Organization. There hasn't been the focus on making this happen. As Bill Gates likes to say, we're still paying for AIDS and malaria and so on through PEPFAR and other U.S. government programs, but we still don't have an agreement on helping countries finance the purchase of these vaccines and making sure that they get access to it. So I think that the vaccination strategy should be really a very important policy issue. I think that from a point of view of macro management, we have to distinguish the pre from the post-vaccination period. In the pre-vaccination period, we think that we need to be prepared to this stop and go, open and close uncertainty that Lucio was referring to, because countries all want to reopen and recover the economy, but if they lose control of the pandemic, they have to shut down again, as we've seen it happened in Chile. We see it happen several times in Panama and El Salvador. We've seen it happen in Israel. So this period, the pre-vaccination period is going to be always subject to these kinds of potential shocks, and we need to think of that as a special period. And then once the population gets vaccinated, then we can open up more clearly and focus on recovery. I think that the countries are going to need to be able to fund this period. The government has to be fully funded. That they need to get the resources, control of the resources in order to play a positive role. But they also need to signal that in the medium term they'll be good for the money. And so we've been thinking that this is the right time not to impose a tax, but at least to approve a tax to be implemented during the recovery. So we're looking at ways in which we can make a progressive tax reform that, as Lucy also said, it doesn't let the good crisis go to waste, fixes problems that countries have in their current tax structure. In particular, we think that they tend to have very, very low levels of taxation of capital that is limiting, the redistributive function that tax policy could play. And we need to assure that we don't get a crisis from here to there. That very often countries get into these triple crises of a public debt crisis, a banking crisis, and a currency crisis. So we want to make sure that doesn't happen. That the economy is adequately protected, because if these crises do happen, they become a problem of their own, and they slow down any potential recovery. And finally, we think that there is a coming equity shortage in firms, that you're going to have firms that have potentially a bright future after the vaccination process, but they'll have very damaged balance sheets. They can borrow, but they're to a limit because they cannot be over leveraged. So we think that the amount of equity in firms is going to become the binding constraint. And we need to be thinking of ways in which we can inject equity in those firms so as to accelerate any recovery that happens afterwards. So those are some of the ideas that we've been focusing on. And now let me stop here. And I think we are ready to hear your. Yeah, good, excellent. So Chuck, you guys.
We have a couple questions. So, and we still have about 10 minutes for folks to submit a few others. The first one comes from an anonymous attendee. Tapping into external financial markets for developing countries mostly means acquiring excessive sovereign debt. Do you think the COVID crisis has the potential to lead to a sovereign debt crisis?
Well, I think that's an excellent question, and it sort of refers to the crisis that we need to avoid. Obviously, the crisis meant that tax revenues fell like a stone. It meant that the ability to spend money in expanding healthcare, in epidemiological interventions, in helping families survive, as Ulrich was pointing out, that being able to make transfers to the poor allows them to survive without leaving their home, so without having to go to work. And that makes lockdowns more effective. So for all of these reasons, there are very, very good reasons for governments to spend more money, for governments to have lower revenues, and consequently for their financing needs to go up. I think most countries that we work on are potentially solvent in the medium term. That's why they need to anchor expectations that they're good for the money. That in the medium term, they'll be okay. Now they need the money, but the capital market should lend them the money because they're good for the money in the medium term. That's how you want to anchor these things. But there are other countries that maybe started this with already the levels of debt that were barely sustainable, and now they may become too high. And for those countries, we have been pushing the idea that we should need more expedited debt restructurings. We're happy to see that some of this has happened through agreements at the G8 level, G7 level, and G20, sorry, that they agreed that bilateral debts would be pared down, but bilateral debts tend to be relatively small in the total mix, and there's some pressure to make sure that China participates in that. But the IMF has just come out with the idea that we need more expedited ways of restructuring other debts for countries that have very high levels of debt. That's something that we pushed for. I wrote an op-ed on that a couple of months ago, but I was very excited to see that the managing director of the IMF, Kristalina Georgieva, has pushed in that same direction.
Few more questions are coming in. What have we learned from China and other Asian countries?
That's an excellent question. By the way, if anybody in the team wants to participate, raise your hand so that we know. But I think the degree to which people take these social distancing norms as part of expected social behavior is very important. I mean, in the U.S., the wearing of masks has become politically meaningful and controversial, and that obviously is not helpful. To the extent that people abide by recommendations of experts, the credibility of those experts, I think that in that sense, the way the Jordanians managed it was really remarkable. So I think from China, we have to learn that contact tracing works, that acting very quickly to stamp out flare-ups, hotspots tends to work. And interestingly enough, I don't know their precise, the reliability of their statistics and so on, but it seems that the economy is open and it's operating quite normally, indicating that they have had success in containing this crisis.
Do you think there are economic predictions or expectations that were made at the beginning of the crisis that proved wrong by this point?
Well, yes, definitely, and maybe the team can also give some examples. But the IMF came out in April during their spring meetings with a scenario in which this was a first semester problem, that there was going to be recovery in the second semester, and a fairly sharp recovery in the second semester. And some of the countries we worked on believed them, and we didn't. We thought, for the reasons that were explained by Ricardo Villasmil, Lucio Castro, Semi, that that this was going to last, and for Shreyas's simulations of this pandemic convinced us that if you just do a lockdown for 2 months and you try to go back to normal, you've just postponed the dynamic of the pandemic. It doesn't change the basic mathematics of the process. You need to be able to social distance to the point where this reproduction rate, the R factor, goes down significantly. And that was going to have significant implications for the economy. So I remember writing an op-ed chastising the international community for preparing for a tropical storm when we were facing a hurricane, category 5 hurricane. So that at least prediction at that time, it was too optimistic from the IMF. I must say that in the months of June, July, the recovery of some of the flows in the developing countries also surprised on the opposite side, that even remittances in Central America bounced back very nicely. And it wasn't clear whether that was because what was underlying it, but the fear is that it had a lot to do with the CARES Act, with these social transfers that were given to households in the US, and that with the end of that fiscal support, that they're going to see less dynamism in remittances going forward. And that's a little bit what's panning out, that the US is slowing down, that in the month of September, job creation in the US was disappointing, and that manifests itself in terms of lower remittances to the countries that live off of remittances sent from the US. So life is full of surprises, but in this particular case, the overall thing is worse than was initially expected, but we have had some periods in which things have surprised on the upside.
Okay, we have just a couple of minutes left. We have a question regarding the aviation sector. How long do you think its effect will last? The pandemic's effect will last in this sector? And because pandemics are coming repeatedly, will this sector continue to be as safe as in past years?
Well, I think that the next pandemic is going to be a different kind of vector. So AIDS was particularly devastating, but it doesn't communicate by sitting on an airplane. It has to be an airborne pathogen and so on that gets transmitted from person to person, and that's in a particular class of things. So we shouldn't think that the next pandemic is going to have necessarily characteristics that are very similar to this one. I think that we will need an international system of certification of vaccination. We've had it for years with the yellow fever and so on, but I think that there won't be a significant recovery of international travel until countries can feel assured that if foreigners come in, they're not going to infect them, and if their nationals go out, they're not going to get infected. And for that, it's very important that the whole world gets vaccinated, and that we have an international agreement, a multilateral agreement on the mutual recognition of certifications of vaccination. Right now in East Asia, there are countries signing bilateral agreements for the mutual recognition of health passports. Now, health passports, bilateral agreements between 100 countries, you need 10,000 bilateral agreements. And the alternative to 10,000 bilateral agreements is one multilateral agreement. And I think that the world should be focused now on a multilateral agreement on how we're going to assure countries assure each other that the people they're sending are vaccinated, or the people that are coming in are vaccinated. And I think that's something that shouldn't be started when the vaccine is there. It's something that should be in place when the vaccine is there. And I think with that, I think that a lot of the travel is going to recover, but we need. But I think that the expectation is that the travel industry is going to be one of the slowest to recover.
Thanks, Ricardo, and thanks to all of our speakers. We have run out of time. Sorry, we couldn't get to a handful of other questions, but I want to be respectful of everybody else's time. I just want to remind folks to, Autumn, if you could put up our URL and social media information, to visit growthlab.cid.harvard.edu for more information on our research projects and opportunities for engagement. We're also very active on social media, including Twitter, Facebook, and you can find our podcasts on Simplecasts. Have a great day, everybody.